health is a medical doctor who understands a lot of these things, and also then take into consideration that there are many health professionals, the KMPDU, for example. You have doctors who sit on the health committee in Parliament. You have all of these individuals who are available in the country. Did Kenya have to say yes? Or was there something that binds Kenya to then agree to do this? And I'm talking from medical points of view.
When you look at the issue of when there's an outbreak like this, or rather there is a pandemic like this, I think also it's very responsible of the American itself to say that they will not have even a quarantine point in America. Because the time it takes for even the symptoms of Ebola to be seen as for this particular strain is all over 21 days. So there's a possibility. In fact, there were reports that are being indicated that there are cases that are being seen now up to Brazil, in South America. So there are chances that if they don't have that particular quarantine point, the way they were putting it, it is a possibility of then a person who is getting in without being noticed. And that's why, as much as that was said, they have actually plans to ensure that there is no surveillance. The point in case on this scenario is, and what is causing the concerns that we had raised, and what actually government ought to look into very strongly, when there is an outbreak like this, a lot of efforts need to be at the point where the disease comes from. We need to see as a country, how do we support Congo or DRC to ensure that this disease ends, that the people that are there are treated and are supported, that we lose less lives in such a scenario. And the same with Uganda, because when we have containment and support within that region, then it means that we'll have less cases of spread of the disease across. But when there's a panic where different countries feel like they cannot be safe to have containments in Congo, and then they have it in other particular countries or other places, then it then means that we can actually have new cases now being carried from the distance of, let's say, like Kivu to Nairobi to Kenya, over 2,000 kilometers. And that's why before that is done, there's a clear way that things need to be put up in place, that there's protection.
Doc, we talk about setting up the Ebola quarantine facility at Laikipia, which is, one would say, is a military facility meant for Americans. That's fine. But we also have to look inward as Kenyans and ask ourselves, how are we dealing with the border at Busia? There's a Kenyan here who's a listener who's saying, we can't talk about setting up a quarantine facility when the borders are still porous with Uganda. We are not even having discussions on how we're going to protect ourselves from Ebola crossing over through the border alone. We are not having those discussions inward as Kenyans. The government is not assuring Kenyans that there is proper surveillance, there is proper monitoring of individuals who have entered the country, say, in the past 21 or 30 days, to be able to know who has come from DRC, from Zaire, for us to know we are doing something right. Can we talk about setting up a quarantine facility without telling Kenyans how you are preventing Ebola from getting into the country to start with?
I know that many countries have not closed their borders because of this particular outbreak, except Uganda that closed the border for DRC because we're seeing a lot of the disease crossing over in their borders. But I believe that just I believe, because I don't know, that these particular 23 quarantine points that are talked about by the government should be at these particular border positions, because that is the most high places there where we would have higher suspicions, and also around these particular points of entry like the airport and the likes. That's one thing that I will suspect from this particular conversation. But then also giving credit where it's due, that we have had these cases of Ebola since 1976, different outbreaks. In fact, if you look at history, it's almost every 2 years there has been outbreaks either in DRC or in Uganda or in West Africa. But we have not had any case that has been reported or confirmed in the country. So it means that whatever surveillance has been there, to the extent that it has been, it has made sure that we have not had a case in the country, because we have quite close proximity to Uganda and even DRC. But because this one is coming at a time also when there's an extensive war in DRC, and we've had reported cases whereby the quarantine units in DRC are even being burnt down by the community, so people end up mixing down with the community, and that means that there's more spread. And I think this has well been reported by WHO. So ideally, this is a time that government need to give more confidence to the public, and not just by talking, by showing what they're doing within the borders. And see, also health is in Kenya is very different because there's an aspect of it that is devolved. So it means that the county government must be brought on board so urgently and so quickly to also reinforce the same standards of the policy pertaining to the surveillance and pertaining to actually ensuring that those border checks are actually working.
Okay.
Yes, so that's one thing that need to be there strongly. But also, as I keep on saying, this cannot just be there by word of mouth. This has to be there by us seeing what is being done. And the biggest impediment to any health services in the country, I can keep on saying, is health workforce. If you say you've deployed 1,000 health workers or 2,000 health workers to help handle the issues of Ebola, and we have not seen employment of the same, then we are wondering, have they left the wards into the surveillance units or to this screening? Because that is key. We need to see health workers actually being deployed, being employed and deployed. Yes.
Do you have any information of any deployment so far of any health workers?
What I know is that the permanent secretary for the public service said that they are deploying 1,000 healthcare workers to help in screenings and in mitigating within different quarantine units that they are indicated. But we have not seen those recruitments, so we don't know whether it is requesting from the counties or from the ministries, from different ministries. Because what then need to be done is we need to see. Yes, because as I said, we have a shortage. We don't have health workforce.
Okay.
Yes.
Who are these quarantine centers for? And I ask this because it's clear from the information that we have so far that the infected Americans or the suspected to be infected Americans will be in these quarantine facilities. Are they for anybody else? Will anybody else then be able to access these facilities if the need arises? Or are they just for Americans?
You know the quarantine that put up for a pandemic like this, like for COVID-19. Essentially, there should always be for anybody suspected to have traveled from the disease-prone region, like from the Congo or from the Uganda part of it, essentially. And that means that when you are suspected, you'll stay there and be monitored for the number of days that for the symptom list 21 days, and then you're okay, you're released back to the community, and if not, then you go to the isolation. That's essentially what it ought to be, and what ought to happen within the quarantines. But then what was causing the uproar over the Laikipia airbase quarantine is that it was not going to bring the suspected. It was not going to be like a place for screening. It was definitely going to pick or to take the DRC Americans and then bring them there for quarantine. And that was the concern. And therefore we came out and asked, why only the Americans? What about these other the Kenyans? And then the minister actually tried to answer that and said the quarantine is open for the Kenyan military, for the Kenyans who are working in the DRC and all that for that particular purpose. From that point, I feel like the concerns that union, like we had, the concerns that civil society have, the issues that was raising a lot of concern, in a way, is being discussed. Because initially nobody was talking about the quarantine unit in Nanyuki. Initially nobody was talking about the plans of this quarantine, the 23 that have been put in place, the plan government had for the public. That was not there before. So in essence, I think the reaction, the concern that the public have put up to the government
is what has made them
is making them now to come up with all these particular responses.
It's interesting. So, I mean, let's look into some brick and mortar here. What happens in a quarantine center? One would imagine that there are patients who obviously would be there and they're being monitored, treated, and then in the unfortunate event of death, for example, that